Welcome to The Explainer. Today we're going to tackle something that's in pretty much everyone's home, the medicine cabinet. We rely on these little pills to make us feel better, but have you ever really stopped to think about how they actually work their magic? Let's dive in.
All right, let's start with a question I'm sure you've asked yourself. You've got a splitting headache, right? You pop a pill, and like magic, the pain starts to fade. But how in the world did that little pill know to go to your head? Well, the truth is, it doesn't. At all. Pills aren't these little smart bombs that zero in on your pain. The way they work is actually much broader and honestly a lot more interesting. Let's get into the science of it.
So think of it this way. A pill is way more like a shotgun than a sniper rifle. Once you swallow it, it dissolves and gets into your bloodstream. And your bloodstream? It's like a superhighway that carries that medicine literally everywhere in your body. Okay, so if the medicine goes everywhere, how come you only feel it working in one spot, right? Well, it's because the medicine only acts where there's a problem. The pain you feel is caused by these chemical signals of inflammation. The medicine is designed to find and block those specific signals. So even though the drug is in your foot, arm, and head, it only kicks into gear where those inflammation signals are firing off. Okay, now we're getting to what might be the most critical part of this whole explainer. Especially for our viewers in Thailand, the term "ya ge aksep," or anti-inflammatory, gets used for two totally different kinds of drugs. And mixing them up isn't just a small mistake, it can be really dangerous. Let's be super clear here. On one side, you've got antibiotics. Their job is to kill bacteria that are causing an infection. On the other side, you have NSAIDs. We're talking about things like ibuprofen. Their job is to reduce pain and swelling from an injury, like if you sprain your ankle. These two things are absolutely not interchangeable. And, one medical expert put it really bluntly. Taking an antibiotic for a sprained ankle does absolutely nothing for your pain. And taking an NSAID for a serious infection, that won't kill the bacteria. This kind of mistake can lead to some really serious problems down the line. Okay, so we've established that not all anti-inflammatories are the same thing. So now let's zoom in a bit more on just the painkiller category. Because even in here, not all pills are created equal. Let's compare the two most common types you're going to find, paracetamol and NSAIDs. You can think of paracetamol as your go-to, your reliable starting point for most general aches and pains. NSAIDs are more powerful, especially for inflammation, but they come with bigger risks if you use them too much or for too long. So the golden rule here, always start with the safest, most basic option first. Now, this is where things get really interesting. It's this idea called synergy. Because paracetamol and NSAIDs work in different ways in your body, you can actually take them together for a much more powerful effect. So think of it like this. If paracetamol gives you 1 point of pain relief and an NSAID gives you 3 points, taking them together doesn't give you 4. It can give you 5 or even 6 points of relief. It's a real game changer. So here's the bottom line, the rules you absolutely need to remember. You can combine paracetamol with one type of NSAID for that extra punch, but, and this is a big one, never, ever take 2 different NSAIDs at the same time. You don't get any more pain relief, but you dramatically increase your risk of side effects. It's all risk and no reward. All right, so picking the right medicine is just half the battle. Taking it correctly, that's just as important. Let's look at 2 of the most common mistakes people make, and we'll start with antibiotics. You know how it is, right? You start a course of antibiotics, and after a couple of days, you start feeling better. And you think, hey, I'm cured. But stopping early is actually incredibly dangerous. What you've done is you've only killed off the weakest bacteria. The strongest, toughest ones are still there. They survive, they multiply, and now you have a much stronger infection. This is how we get superbugs. You have to finish the entire course, every single time. Okay, let's switch over to paracetamol. We've all seen that instruction on the box, right? Take 1 to 2 pills. But that one-size-fits-all advice, well, it's not the full story. For it to be most effective, the dose you take should actually be based on your body weight. So if you weigh less than 50 kilograms, that's about 110 pounds, just one 500 milligram pill is the right dose for you. And if you're over 67 kilograms or about 148 pounds, you'll need 2 pills to get the most effective relief. For anyone in between those weights, 1.5 pills is actually the sweet spot. And this part is absolutely vital. No matter what you weigh, you should never ever take more than 8 pills. That's 4,000 milligrams in a 24-hour period. Pushing past that limit won't give you more pain relief, it just puts you at serious risk for liver damage. So
what does all this mean? What's the big takeaway here? Well, it's that understanding these basic ideas really empowers you. It transforms you from just someone who passively takes a pill into an informed, active participant in your own health.
So let's just recap. Here are your new rules for the medicine cabinet. First, know that anti-inflammatory can mean different things. Always ask if it's an antibiotic or painkiller. Second, always finish your antibiotics. Third, use painkillers only when you really need them. Fourth, dose your paracetamol based on your weight. And finally, and most importantly, if you are ever in doubt, just ask a doctor or a pharmacist. It's that simple.
And that really is the power you have now. Armed with this knowledge, you can make smarter, safer choices. So the next time you feel that ache or pain, you'll know exactly what to do. Thanks for watching.